Good morning, y'all. It's a beautiful day here in Boonville. Hopefully, I'm live. It says I'm 12 minutes into this class. Not true. So hopefully, I don't get kicked off like I did on Friday. It's beautiful outside. It's going to be almost 80 degrees here today. So I've got some sunlight coming in through the door. I've got some backlight. I've got some front light. Hopefully, the light on Friday. So I'm going to go back a little bit. I went over, good morning, Eileen. I went over an article from Gentleman's Quarterly, GQ magazine, from 2011, basically saying the same thing I've been teaching you, that counting calories doesn't help you lose weight. Exercising more doesn't help you lose weight. And they were talking about the differences in dairy products, specifically milk. And so to reiterate that, remember that whole milk has 8 grams of fat, 2% milk has 4 grams of fat, 1% milk has no fat. But if you look at low fat milk, 1% and skim milk, um, that hasn't been processed, it's kind of a light blue color. So to make it white, so it doesn't look gross, they put milk powder in there. And it turns out that drinking low fat milk and skim milk is actually more fattening than drinking whole milk. So we're going to reiterate some, and this is from Jason Fung's book, The Dive into this book. Yeah, it's that important, I think. So dairy proteins stimulate high levels of insulin, partially due to the incretin effect, and we'll kind of review that a little bit. Those are hormones produced by the fundus of the stomach when you put food in your stomach. But dairy proteins do not raise your blood sugar that much. So if insulin increases, does that mean that it's not really carbohydrates and not really blood sugar, it's insulin release? So protein containing foods like dairy that has whey protein may stimulate insulin partially due to that incretin effect. So there's the hormones which are secreted in the stomach. They help with digestion, they stimulate insulin, and they slow gastric emptying time. Um, but they're all released, or the two that we know about, and there's probably more, are released when you eat all 3 of the macronutrients. So fats, proteins, and insulin levels, not just carbohydrates. However, dietary fats have the lowest effect on insulin secretion. So that's the basis of the high fat, low carb dietary advice. So only carbohydrates have a significant effect on blood sugar levels. So starch foods, there's a pretty good correlation between glycemic index and insulin index. And the insulin index was released in 1997 that pretty much showed that glycemic index and insulin index do not mirror each other. It was previously thought that they did. So there's a large discrepancy when you look at dairy products. So most dairy foods have a pretty low glycemic index of 15 to 30. So very high insulin index scores of about 90 to 98. So that's dairy products. So that kind of implicates that dairy protein is a major contributor to diabetes and obesity, what Dr. Fung and others call diabesity. So there is some evidence that suggests that's true, and this is from the ethics study of 38,000 participants in Europe. It was a large European study where they were followed over 10 years prospectively, an increasing total protein and animal protein consumption was associated with a modest but significant increase in the fish deal. So one of the dietary recommendations that you hear all the time is to eat fish 3 times a week. If you haven't seen it, please watch the Netflix documentary Seaspiracy. It's a fascinating documentary. It will get you rethinking your fish intake and what you're contributing to the decimation of the earth. And I'll put up a link later specifically about that particular documentary. It's a fascinating and actually horrifying and scary thing to watch. So fish contains omega-3 fat content. Advised to eat more fish. You know, we have a discrepancy of omega-3 to omega-6 ratios. We used to eat omega-3 to omega-6 ratios of about, almost 1 to 1. And over the last 50 years, it's 1 to 20. So omega-6 fat content, 20 to 1 omega-3 content of our diet. So omega-3 fats are known to alter the expression of peroxisome proliferator activator receptor genes. Looked at the data from the Nurses' Health Study 1 and 2 and the Health Professionals Follow-Up. That was 195,000 people followed over 14 to 18 years. And there was a paper published in 2009 regarding this particular dietary recommendation, eat more fish. To their surprise, the researchers, it kind of invalidated their hypothesis that eating fish was good for you. There was no benefit from eating more fish. In fact, the opposite seemed to be true. There was a modest but significant increase in diabetes, 195,000 diabetes. So looking at that, it appears that high protein intake, particularly animal proteins, may be detrimental, perhaps due in part to the incretin effect. So should we all go vegan? Well, if you watch Seaspiracy, you'll quit eating fish, trust me. The data on vegan diets is unclear. So with regards to dairy, other large observational studies seem to indicate that increased dairy consumption leads to less weight gain. Increased dairy consumption leads to less weight gain. This is observational studies. So this relationship was looked at in a paper published in 2006. That used dietary recall. So there's the fault in the study, is dietary recall isn't probably that accurate, to estimate dairy product intake and then compare that to weight changes. So there was a modest effect, but there was no increase in weight gain with increased dairy products. So if you looked at different milk products, the consumption of whole milk or sour milk, cheese, and butter seemed to be associated with less weight gain. And then interestingly, drinking less low-fat milk, meaning more whole milk, resulted in less weight gain. So drinking skim milk and weight gain. The cardia study in the United States was almost 3,200 young adults in 4 metropolitan areas, and they measured the markers of metabolic syndrome, including obesity, over a 10-year period. And the group with the highest intake of dairy intake, I just said intake twice, the group with the highest intake of dairy products seemed to have the lowest incidence of obesity. And then the study was also confirmed with the rest of the metabolic syndrome. So higher intakes of dairy were protective. And then a study in similarly showed that higher consumption of dairy was correlated to a lower risk of the cardia, C-A-R-D-I-A. I won't tell you what that stands for because I'll trip over it. Further investigated the independent effect of fiber on the metabolic syndrome. So a reference of 1 was chosen for the group that had both high dairy and high fiber intake. So taking high dairy but low fiber almost tripled the risk of insulin resistance syndrome, as did low dairy but high fiber. Increased the risk of insulin resistance by 7 times. We did a class 3 months ago based on research from a guy that says you can reverse type 2 diabetes by eating 100% fiber for 3 weeks. So this is not good news for the standard American diet, which is 50% carbohydrates, right? Milk consumption has been declining. We've been told that fat in milk is bad for our hearts since 1977. And increased processing of food has stripped the dietary fiber out of natural foods. We call SAD at the highest risk category with 7 times the risk of insulin resistance. So data is conflicting. Some studies show that higher protein intake is bad for you. You gain too much weight, while other studies with good data suggest that it's good for you. Lots of arguments on internet bulletin boards and in academia. There are those that believe dairy should be excluded from our diet, so that's the paleo diet people. There's those that believe that red meat should be excluded, so vegans and vegetarians. And there are those that believe our dietary. So that's the dairy story. Tomorrow we're going to start talking about red meat, and I'll do that from my classroom at State Fair Community College for that particular class. So today we're going to look at protein fattening as well. So the weight gaining potential of protein, very difficult to figure out. So this area of research has kind of been on fire since about 2010. So there's more and more information all the time since we have this epidemic of obesity and type 2 diabetes, and no change. Higher carbohydrate diet recommendations from the USDA in 1977. So universally, most people feel that refined carbohydrates, so white flour and sugar, are considered fattening. But there's a maddening debate in flux all the time about dietary protein. And the most controversial are dairy proteins, which we just discussed, and then discussed in red meat. So the answer is not easy, and there's good data that supports both points of view. So there's 2 considerations: the incretin effect and the dose of dairy protein. Hormone release from sugar account for only 23% of the rise in insulin release from the pancreas. And they don't really understand completely what causes insulin release, but only 23% of it has to do with blood sugar levels. So the incretins, GLP-1 and GIP, not only raise insulin, but they have other effects. Okay, so GLP-1 has been shown not only to increase insulin concentration and secretion, but it plays a control in the emptying the stomach. Effective to and beneficial to fiber, which does the same thing. So what if you used a drug that mimicked the effects of GLP-1? The first one that was developed, of course, was Byetta, B-Y-E-T-T-A. It was isolated in the saliva of Gila monsters. The drug was approved for treatment of type 2 diabetes, and it mimics the effect of GLP-1, causing an increase in insulin secretion, so lowering of blood sugar via the incretin effect, and so blood glucose is lowered by that effect as opposed to actually agonist or mimic agent. So it's been used for type 2 diabetes for years. Other effects have been noticed that slows gastric emptying, so there's a feeling of nausea and GI upset in 57% of patients. So normalization of the stomach involves holding the food just eaten. You mix it with hydrochloric acid from the parietal cells of your stomach, and then slowly discharging the contents of the stomach into the intestine, kind of as a pulsatile or measured pace. Okay, so with Byetta, much of nausea and overhead because it's that is talking to your hypothalamus, the seat of your I'm full center. Okay, so that's similar to the effect of dietary protein seen that we discussed in the first part of this class, where whey protein, and actually last Wednesday, where whey protein caused the greatest increase in insulin, but also the greatest increase in feeling full. So protein shakes are frequently whey-based, and even though you have an insulin response, you feel full, so your caloric intake, you don't eat as much, in other words. Full calorie portions. But after that, they were given an all-you-can-eat buffet after taking the protein by mouth, and then monitored for the amount eaten. So the amount of food consumed after whey protein was significantly less than with egg or turkey. So that's the effect of a whey protein shake. So I keep working on a different protein shake, either rice protein or pea protein, which does not have the insulin effect. Hopefully by this summer. We'll see. I've been working on this since July. I do have the whey protein shake and body solution systems at this point, only available through a med spa or physician's office. Okay, so dietary proteins tend to cause you to feel full for longer. So let's say you eat steak versus ice cream. Okay, how long would you feel full after the steak versus eating the ice cream? So the steak is probably going to make you feel full longer because it slows it sits in your stomach. It slows gastric emptying. These they don't sit in your stomach for very long. Once you eat them, they just go through and you become hungry again, similar to Chinese food, which of course has rice carbohydrates. So there's two opposing effects of incretins on weight. So there's insulin and stomach emptying effects from those two hormones. So insulin may be fattening, but since the stomach is fuller for a longer period of time, your satiety mechanisms through your hypothalamus are activated and you feel full and you do not eat as much later on. So that's how protein. It does slow gastric emptying. You feel full for a longer period of time. Okay, so what if you could give incretins? Okay, so this class of drugs is the Byetta we just talked about, and then Victoza, which is also used for type 2 diabetes and it's not an insulin. Okay, so those are not associated with weight gain despite the increase in insulin levels. Okay, both drugs cause weight loss due to the effect on stomach motility. Okay, so it appears that stimulation of the incretin effect, which with GLP-1 triggers more weight loss, but that's only found with two different hormones, GLP-1 and GIP. There may be more that are discovered later. So whey protein may have more of an effect on GIP rather than GLP-1. So Byetta is an agonist of GLP-1. So there's also another class of medications called DPP4, inhibitors, which stands for the enzyme dipeptidyl peptidase 4, and that's the only time I'll say it. I did not trip over that. You're welcome. So sitagliptin and saxagliptin, I did. That enzyme is what breaks down both GIP and GLP-1. So blocking that enzyme leads to an increase in the incretin hormones. Okay, so DPP4 leads to less incretin. If you block DPP4, that leads to higher incretin. Okay, so you have an increase in both of the incretin stomach fundus hormones. So does that lead to weight loss? If you block that enzyme, turns out it does not. They do not lead to weight gain either. So they're basically weight neutral. This is so which specific incretin is stimulated may be important in determining weight gain or loss. So that is raising both of them. Byetta is simulating or an agonist of GLP-1 only. Percent carbohydrate. So it's easy to eat more carbohydrate. If you want another slice of bread, some more pasta, if you want to increase your protein, you could eat a steak. So can you increase dairy protein alone? So can you eat a huge slab of cheese for dinner, for instance? How about several gallons of milk with your meal? Now I know teenage males can do that sometimes. What about 2 large tubs of yogurt for lunch? Okay, so it's not that easy to increase dairy proteins without resorting to whey protein shakes and for nutrient composition of your diet. A huge change in diet composition, so that's the low carbohydrate approach. So if you get down to 10% carb intake, that's pretty easy to do. So even if dairy proteins are stimulating insulin, you don't eat enough or drink enough of those proteins to make a large difference in the overall scheme of your dietary journey. Okay? So when we talk about red meat and other proteins, the story is different. So it's not that it's bread for an extra hamburger patty, eat more chicken, have a large steak, eat a bowl of chili. So what's the effect of whey protein on weight gain? What's the effect of red meat on weight gain? Okay, so we always talk about balancing diets, and one of the issues with the powers that be about lower carbohydrate diets is that it's an unbalanced diet. It puts the dietary intake out of balance. Although they tell you to eat low fat, which does the same thing. Okay. So the answers to all this are far from clear. That's why I'm spending so much time. And intake of red meat. So we'll talk about the story of red meat and what it does. I've already showed you that low-fat milk, 1%, and skim milk is actually bad for your heart because it oxidizes cholesterol. Oxidized cholesterol causes inflammation, and inflammation causes plaque from damage to the endothelial cell lining of your vessels and leads to heart disease. So, fish raises your risk of diabetes by 23%. Watch Seaspiracy. I'll put it up later. All my classes are on YouTube at Health Without Risk. Go to the website, Health Without Risk. It's going to take me a little while to research and get back to. So I kind of like those challenges. So if you got a challenge, let me help you. I'll guide you in the right direction. I'll see you tomorrow about 10 a.m. from State Fair Community College in my lab in my classroom. We'll talk about red meat. Have a great day. It's going to be 80 here in Boonville. It seems to be spring, although it's headed back to the 40s later this week. So have a great day. See you later. Bye.